Shall we start? Is it live?
हमसे बेहतर हम बोलो वंदे मातरम, आत्मनिर्भर हम बोलो वंदे मातरम। शून्य में संभावना आता हमें है देखना, विश्वविद्यालय तक्षशिला विश्व को पहला मिला। शल्य शुश्रुत प्रदान है, दुनिया के लिए वरदान है।
लोक के कलिसिद्धे नाभू वसुधैव कुटुम्बकम्, आत्मनिर्भररू अतिवन्दे मातरम्, नमगिल्ल सरि समरू अतिवन्दे मातरम्। योगमे रामबाणं तरतरालयी ध्यानं, ताजमहल तलमानिकं देशపు గర్వ కారణం। కొల్లూరులోని కోహినూరు విశ్వమంతటికి జోహారు। రామన్ కండ కోట్పాడే రామన్ విளைவின் வெளிப்பாடே। ఆత్మనిర్భరతా చలు వందే మాతరం, రాముల గంబెల్లు చలు వందే మాతరం। सब देशी अपनान लगे, विदेशी बजान लगे। हो जाता है सिलसिला जो चंदे पानी है मिलया। USB भी असी दिता ना पुछो की है किता। हर गोबिंद दे है नाज सानू, DNA दा राज सानू। देश दी स्वदेश दी है खोज पेंटियम। आत्मनिर्भर हाँ असी वंदे मातरम, अपने तो बेहतर असी वंदे मातरम। आत्मनिर्भर हाँ असी वंदे मातरम, अपने तो बेहतर असी वंदे मातरम।
मैनकाइंड फार्मा, दिल से स्वदेशी, जान हिंदुस्तान।
Navneet, you are on mute. Thank you for the information. You are braver than you believe, stronger than you seem, smarter than you think, and twice as beautiful as you would ever imagine. Life is not about how hard of a hit you can give. It is about how many you can take and still keep moving forward. Some days, there won't be a song in your heart, but you sing anyway. Good morning, everyone. I'm Navneet from the Corporate HR team, Delhi, cordially inviting Dr. Niti Raizada and all the Mankindians who have gotten together from all parts of the globe. October is Breast Cancer Awareness Month, and today we have come together to celebrate it by creating the essential awareness among our high-spirited employees. Our employees are the most valuable assets of our organization and a sustained competitive advantage. Hence, employee as well as their families' health and well-being are of enormous responsibility to us. In accord with the same, we are overjoyed and thankful to our esteemed doctor, Dr. Niti Raizada, Senior Director, Medical Oncology and Hemato-Oncology, Fortis Group of Hospitals, Bangalore, who has spared her valuable time and decided to impart her knowledge and create awareness about breast cancer. With this, may we request Dr. Niti Raizada to kindly enlighten and share her valuable insights. Employees can share their questions in the chat box. Dr. Niti will answer them post her session. Over to you, ma'am. Thank you so much.
Good morning, everyone. Thanks so much, Navneet, for the introduction. Thanks, Pallavi, and thanks to everybody in Mankind for having invited me today. Well, yes, it's a very important topic for all of us to discuss. And I would like to share my view and, of course, the data we have about breast cancer. And why now? Because October happens to be Breast Cancer Awareness Month. And all of us tend to, as oncologists, our job is to spread awareness so that we can diagnose patients early and on time and try to reduce the disease burden in whatever small way we can. So these are all the survivors, and these are all the people who fought the battle, who some of them could not actually win, but bravely fought the battle and talk about cancer. So here we are discussing the same issue. And why cancer now? Well, in the last decade, all of us would possibly talk about cardiovascular ailments because that was a leading non-communicable disease. Still, cardiovascular and pulmonary ailments are very important. However, all of our shift is towards something which we can do constructively. And in this time and age, we know that the number of cancer cases are significantly rising, not just because of increasing aging population, but because of lifestyle changes. And this is something which we can work on and change towards reducing the tumor burden. And whenever there's already an existing cancer, to treat it right, treat it at the right time, diagnose early, and treat them effectively. So as I said, October is Breast Cancer Awareness Month. And why we want to talk about breast cancer is because until now, people considered it as a stigma, a thing which we cannot share in our neighborhood and in our society. But we should realize that it is not a stigma. It is not a contagious disease. It's not something which happens by talking or touching. And yes, we also know that it can be prevented. So you can actually prevent the occurrence of this cancer, and wherever it cannot be prevented, it can be conquered, and it can be treated at all stages, whether it's early stage or it's advanced stage. And there's something also known as stage 0, which is known as the pre-malignant stage, pre-cancerous stage. So when you're diagnosed in pre-cancerous or stage 0, you can actually prevent the occurrence of cancer as well. So starting from the very basic question, what is cancer? Well, cancer is characterized by unrestricted growth of any part of the body. So when it happens in blood, it's called as blood cancer. If it's in lymph node, it's called as lymphomas. If it is in soft tissue parts like fat, bone, it can become a sarcoma. When it's in breast, it's known as breast cancer. So cancer is unregulated, uncontrolled growth in any part of the body. But when we have to summarize the type of cancers, if we know only about 3 cancers, that is breast cancer in a woman, prostate cancer in a male, and lung cancer in both genders, almost 60% of all cancers we are aware of. So only these 3 information we have, breast cancer, prostate cancer, and lung cancer, we know about most of the issue which deals with cancer. 50 to 70% of all the cancer deaths happen in developing countries like ours. And this is the number which we have to change by this discussion, by this campaign, which we are fighting. 1 in 5 male and 1 in 6 women each year in their entire lifetime, 20% of the global population is at risk of cancer in their lifetime. Imagine the global burden of cancer, some of which we know about, but most of it is hidden. So what we know about is only tip of the iceberg, and a lot of data is unrevealed or hidden. What is the statistics in our country? Almost 22 lakh population are living with cancer. Living with cancer is the population which is currently on treatment and which has already lived through treatment. So they are survivors. So people living with cancer is also a very different set of people who actually have gone through the social issues, psychological issues, economic issues, and then they are living on the other side of cancer. In our country, before 75 years of age, 10% of women and 10% of males are at risk of cancer. So imagine with 1.4 billion population, if we have 10% people at risk of cancer, the burden can be unimaginable. And so we need to gear up our resources, not just in terms of medical facility, but in pharma support, in everything. I mean, sometimes we talk about shortage of drugs. There's a global shortage of drugs. And why is that? The numbers are rising. And at this juncture, the healthcare system has to mount up to meet the requirement. This is a very interesting map which I found, which was actually estimated breast cancer population during election time. And they actually during consensus, they actually were taking the census during Lok Sabha election time, in which they found out that South India has actually a significantly higher number of breast cancer cases, even west of India. Also, there's a large pocket in Punjab. So what I can say, I'm located out of Bangalore, and I can say that Bangalore is the breast cancer capital of the country. If the average is a certain number, we have a higher number recorded in all the hospitals. So hospital-based registry records the highest number of breast cancer in Bangalore. And the reason is twofold. One is that there's also a migrant population. So people want their parents to come here and take treatment. But importantly, there is awareness. Importantly, we have younger women who come to the hospital. Importantly, when we do talks like these, there are people who recognize that there's a problem that they need to address. And that's the wisdom actually we get through all this. They come and then they get themselves examined, and we find smaller lesions. Till 5-6 years back, we used to say that majority patients are advanced cases. But now, sitting in a hospital in Bangalore, I can say majority of our cases are early stage, which is an interesting change. I mean, we are talking about an entirely different set of population which is going to survive through this problem, get cured, and will have other things to look at beyond 10 years, 20 years, 40 years of their life. And these are some of the people who spoke about the problem at important platforms and are big-time celebrities talking about breast cancer awareness. Tahira Kashyap recently was diagnosed with breast cancer. She even flaunts her surgical scar, as you can see. Big-time filmmaker and an author. Hamza Nandini, who's a Telugu film star, was diagnosed with locally advanced breast cancer, that is stage 3 breast cancer at 37 years of age in 2021. She has done well, and now she's again back in cinema as well. So what is some global data? Well, we know that 1 in 8 women across the globe are at risk of breast cancer. As I just mentioned, the data in our country remains kind of hidden. We really don't know what are the exact figures, but at this juncture, we know that about 1.78 lakh women are diagnosed each year with breast cancer in India. 1 in 22 women in our country are affected at this juncture. And these are the numbers which are brought to ICMR attention or the data attention. Every 6.5 minutes, one woman develops breast cancer. And sadly, every 12 minutes, one woman in our country dies of breast cancer. 26% of all cancers in women in India are only breast cancer. So imagine 1/4 of all women breast cancers are only breast cancer. So if we just know about breast cancer, we know about 1/4 of the cancer-related women problem. And lifestyle happens to be most important consideration or most important reason. What are some other cancers in both gender? Well, again, if you combine men and women, even together, breast cancer is 13% of all cancers. We have very unique type of cancer in our country known as oral cavity head and neck cancer. So lip and oral cavity cancer also happens to be the second most common cancer. Again, a woman-centric cancer. Cervix cancer is the third leading cause of cancer in both genders. So if you combine men and women, even the cervix cancer crosses lines when you combine even the cancers in men. And fourth common cancer is lung cancer. Only women-centric cancer, well, breast is the first, cervix, and then ovary. So what are some of the risk factors? Well, age is the most important consideration. Also, we know that lifespan of individuals in our country has increased more than 25 years from the time of independence till now. So that time when the lifespan used to be called as 50 years, Now we are more than 77 as our average lifespan. And that has added to the tumor burden or the burden of cancer cases, of all type of cases, but definitely breast cancer cases. But there is a very different angle to age in breast. What we see in a higher age group in the West, which happens to be between 50 and 65 years of age, in our country, a very common age group is 35 to 50. So they are younger women with younger family and a productive life, which is affected with cancer. Sorry. So we have cancer which happens a decade earlier, and we see quite a few women in their 40s having cancer. What we also know is that younger women have more aggressive cancer, and unfortunately, because we are not suspecting cancer at that age, quite a few gets unnoticed. It could also be related to pregnancy related changes. So you could be having breast changes related to pregnancy, and that time a mass may be accidentally missed. So there are a significant number of pregnancy related cancers also which could be missed. Then there are certain factors which we definitely know about, and oral contraceptive pills has added a lot of controversy around this topic of breast cancer. And there are a lot of thoughts around and some data as well from larger population-based study, that long-term use of birth control pills or long-term use of oral contraceptive pills can actually increase the incidence of cancer. And what we also know is that when you stop the usage of oral contraceptive pill, that actually the incidence also comes down. So the length of exposure of OCPs does cause harm. And the second thing is hormone replacement therapy in the perimenopausal age group in elderly women, where the estrogen component is high in the hormone use, can also add to cancer burden. Then there is definitely a controversy around in vitro fertilization. We have been talking a lot about young couples undergoing fertility treatment, and infertility also seems to be a new age problem. And yes, there is data which says that hormone exposure or inherent reasons for infertility can add to risk of breast cancer. Why, as I said, that this is the time where you actually can miss a cancer, because one, you're not suspecting, and secondly, you may be undergoing so many other things in the process in which you are missing. So you're actually undergoing an IVF procedure and somebody has forgotten to see that this breast requires attention, or in pregnancy there's a breast lump which required attention. So what you can do to yourself, at least start a self breast examination. And this self breast examination can start in your 20s. Every once a month, do a self breast examination. Use a 3-finger technique, which could be a zigzag method, or it could be circular in an anti-clockwise or a clockwise movement, and check both the breast with your contralateral arm, right breast with your left arm, left breast with your right arm. Also examine your neck and the underarm areas as well. And of course, preferably not during periods, because that's the time your breast could be more tender. Always watch a good video and follow the techniques on a monthly basis. What are some other issues when you have a young woman who has breast cancer? Well, fertility, as I said, for a woman who has had breast cancer is also important. So a 31-year-old or a 29-year-old recently married woman will come to us and who's diagnosed with breast cancer, and you tell her that the results are pretty good because of stage 1 cancer. First thing she will ask is, can she breastfeed? If she has a kid, can she have a kid? And therefore, fertility issues are very important. While planning treatment, we have to look for breast cancer survivorship, and we have to offer them fertility preservation methods as well. You have to recommend ways in which they can conserve or preserve their fertility. Embryo cryopreservation is one of them. If there's pregnancy-related breast cancer, that time you're already pregnant and you have breast cancer, That time, not just maternal well-being is important, fetal well-being is also important. I mean, if the fetus is already in the second trimester or the third trimester, then you have to ensure that you use safe techniques so that fetal well-being is preserved and maternal results are not compromised. When we talk about female breast cancer, there is an incidence of male breast cancer as well. So if there are 100 people with breast cancer, 1 out of them will be a male, which is known as male pink. They generally have chest wall ulceration, generally not suspected ulcers, which could be missed. And then, yes, there is a significant trend to have more family history in such patients of cancer. COVID has been interesting times in which we missed a lot of cancer. There was a lot of delay. And of course, with a parallel cancer pandemic running, which we totally forgot. But what was also kind of surprising is that a gentleman or a woman would have a CT scan for COVID and you would find a lung mass. One example is Sanjay Dutt, in which a CT scan was done for suspected COVID and you found a lung mass. There are numerous patients in our practice who had lymph nodes which were diagnosed during COVID, which were related to cancer, breast masses, which was actually breast cancer related to, are diagnosed during COVID because of a CT scan. Certain other risk factors which we all should know. And one important consideration is body weight. And having a good body weight early on in life is protective as well. I'll talk about alcohol and smoking as well. Well, this is a topic none of us would appreciate, but then yes, both of them also increase risk factor of cancer and of course, breast cancer. There's a term known as heritable or hereditary cancer, which is not the same as genetic cancer. So hereditary is when your family members, whether it could be first degree family members, second degree or third degree. First degree means your immediate member, like your brothers, sisters, or your parents or your kids have cancers. And second degree is the person next to that in your relation. So heritable cancers is the group of cancers which we should always look for. And the prime example for this is Angelina Jolie, and this is currently known as the Angelina effect, in which she had a high-risk gene known as a BRCA, breast cancer gene. Her mother had breast cancer and her auntie, her aunt had breast cancer and her maternal grandmom also had breast cancer. And therefore, she got a genetic testing done in which her blood sample was taken, which found out that she had a high penetrance mutation. And therefore, she underwent a risk reduction procedure. And after the risk reduction procedure, she is relatively well preserved and is on regular screening, but at this juncture, cancer-free. So we have to identify families who could be carrying a risk of cancer as well. Sanjay Dutt had a mom who had pancreatic cancer. So Sanjay Dutt had lung cancer, and his mom, who actually passed away on the day his first movie, Rocky, was released, had pancreatic cancer as well. What we do is, well, when a person comes for screening, we identify patients who require high-risk screening. If at all they fall in the category of evaluation for heritable cancers, a genetic counseling, and if required, a genetic testing by a blood test or a saliva test is done. So adding your units of alcohol can add to breast cancer risk, besides other cancers, including gastric cancer, pancreatic cancer, and head and neck cancer as well. Body mass index, higher body mass index not just increases the risk of breast cancer, but various other cancers, including uterine cancer, which is also a women cancer. And then, of course, gallbladder cancer, which is very unique to our subcontinent as well. I just spoke about IVF. And there's another interesting fact which we should talk about, which all of us, probably see a movie and think that, well, yes, is there something different? Well, breast implants also have been, again, a new age issue. And cosmetic breast implants have also been implicated in certain types of cancer. And this could be that we actually miss a cancer behind a breast implant. That is one issue. But sadly, there are other issues like scar-related squamous cell carcinomas and ALCL, which is anaplastic large cell lymphoma, which could be associated with breast implants. Different diagnostic modalities are needed, and trained personnel who understand these kind of issues should be the people who should evaluate and treat the patient. So when I talk about risk, let me also briefly talk about what can lower our risk. Healthy body weight can lower our risk. Yes. Good physical activity, which includes brisk activity, moderate to severe or heavy exercises, 30 to 40 minutes, almost 5 times a week, can improve or lower our risk of breast cancer. Not smoking and not consuming alcohol. What are the symptoms which all of us should watch? It could be just a breast lump, which could be painless or painful. There could be some skin changes like puckering of the skin, or there could be stretching of the skin, or constant itching in one part of the skin of the breast. There could be lump, not just in the breast, but in the underarm, in the neck as well. Nipple could have inversion or eversion, which was not there before, or could have bloody nipple discharge. Remember that young women with painless or painful lumps may often be non-cancerous, but each lump requires at least an evaluation. They could be fibroadenomas, they could be fibrocystic changes, and most of them will only require follow-up and no detailed investigations. So talking about screening. Now, as I said, all oncologists strive to talk to the general population about prevention of cancer. And this entire dynamics is known as preventive oncology, in which we try to detect population which is healthy, which does not have signs and symptoms, but have risk of common type of cancers. I just mentioned about certain cancers which are very common, like lung, prostate, and breast. So in women, cervix, head and neck as well. We try to diagnose patients who don't have frank symptoms for precancerous lesion or potentially cancerous lesion. What does screening do? Well, they diagnose cancer at a much early stage. So first, identify a patient, whether that lady falls into standard risk or high risk category. High risk category, what I just mentioned, is the person who possibly has risk factors like consumption of excess alcohol or or excess tobacco in any form. If body mass index is significantly high, if there's a familial or hereditary cancer gene positive, they fall in high risk category. A standard screening for a woman includes breast screening and a cervix cancer screening. So what are the standard screening recommendations? Every woman in your 20s should start a self breast examination done once a month, in which you understand whether it can be a circular movement of checking or it could be a zigzag fashion movement of checking. Once a month, not during your periods. Have your cell phone calendar with your noted date in which you will be checking yourself. Any lump, please bring to medical attention. In your 30s, a clinical breast examination done 1 in 6 months by a trained clinician to see whether there's any unusual changes in the breast which requires further investigation. Starting from 40 years of age, a mammogram is recommended, which could be every once a year or 1 in 2 years. There is some controversy in your 40s whether you should do regular mammogram. But whenever you do a mammogram in your 40s, an ultrasound is generally recommended because younger women have denser breasts, which sometimes can miss findings in a mammogram. Ultrasound is again a simple scan without any radiation exposure, which can diagnose quite a few things, including infection if it is occult, or cystic changes as well. Certain other screening modalities include CT scan or can include MRI of the breast, but those techniques are used only in very specific situations based on your oncologist advice. Other screening recommendations for women include colorectal screen starting from 45 years of age by just doing a occult stool test. So you check a stool once a year or your feces once a year for looking for occult blood in it. And that's a technique which you should start from 45 years of age. If there's any family history, we start earlier. Lung cancer screening is recommended for chronic smokers from 50 years of age, in which a low-dose CT of the chest is advised. Head and neck screening is recommended for most people who also have chronic dental irritation, or if they consume tobacco in any form, which involves examination of the oral cavity and the neck area in very good light. So how do you detect and diagnose breast cancer? A breast examination. It could be self-examination, especially in our country, but it could be a clinical breast examination, a mammogram, or an ultrasound, sometimes a CT scan or an MRI. After finding that there is a lesion, normally we recommend a fine needle test or a biopsy. Most of the time, biopsy is a suitable method, and yes, it does not spread cancer. When we have a biopsy specimen, we not just look for morphology, which is cancer or not, but we look for the subtype of cancer, whether it's luminal A, it's luminal B, it's HER2 positive, or it's triple negative. Based on that, we do treatment planning. First thing for treatment plan is to know the exact stage of cancer. And it could also be stage 0, which is known as precancerous stage, which is generally managed only with surgery. They could be stage 1, 2, 3, 4, and 4 means when it is spread to other organs. PET scan is recommended, especially in locally advanced or metastatic stage, especially in our settings, where PET scan is relatively easy to perform and a comprehensive scan as well. When there is a diagnosis and a staging modality, we normally sit across a tumor board and plan whether the patient needs surgery, which is more and more focused, therefore more breast conserving surgery. You don't lose your breast to breast cancer. So more focused surgery, you have more precise drugs known as targeted drugs. Radiation is also more precise, known as precision radiation, chemotherapies which are given often, and hormonal therapies as well. Certain other things which we should know about, well, cancers in general are not contagious. And yes, breast cancer is not contagious. Does not spread by kissing, touching, hugging, no. A push bra does not cause or increase the risk of breast cancer. Deodorants or other chemicals which are used as cosmetics do not cause breast cancer. Mammogram per se do not cause breast cancer and do not increase your radiation risk significantly. What are some of the preventive things we can do? All of which I spoke about. Well, exercise regularly, keep your weight under check, try to eat healthy, which is focused with fruits and vegetables and slightly less in red meat if possible. Watch out for any changes in your breast. Go for a mammogram starting at 40. Limit your alcohol consumption. Try to avoid smoking totally. Breastfeeding has preventive recommendation. So a woman who has breastfed babies for a long duration has breast cancer prevention as well. Limit your hormone use to bare minimum and limit wherever possible exposure to pollution. Knowledge, as we say, is power, and here we are just doing that. So please come out of your comfort zone and try to take control of your health. Thanks so much.
Thank you, ma'am, for your valuable insights. We have a couple of questions coming up from our team. So one of them is breast cancer a hereditary disease? Which you have already answered, but I think they want to hear it again from you.
Breast cancer per se is not hereditary. 90% of all cancers don't have a hereditary link, but 10% patients could have some hereditary gene. So we have to identify those patients. Generally, triple negative breast cancer, younger women who have family histories or multicentric tumors are the people who need to be worked up for genetic hereditary cancers.
Thank you, ma'am, for the clarity. There's another one coming up, which is, does having children reduce the chances of breast cancer?
So yes, actually, this is, again, it's not something which we have control on, but yes, the number of kids can have a change of hormonal spectrum of a woman, the hormone length of hormones that is exposed, and yes, it has some preventive action as well. Then the other thing I mentioned is breastfeeding does have preventive action. So having kids and breastfeeding both can have some kind of a prevention it confers. Yes, sir.
Before we move to the next question from Navneet, just wanted to know from this perspective, having a children, does the age at which a woman has a children will have any influence, ma'am?
Very much. See, the length of hormone exposure is what I said is the key. So if you have early menarche, late menopause, that exposes you to a lot of hormones. If you have the first childbirth late in life, then you're already exposed to a lot of hormones. And therefore, the risk is slightly higher than having a child at an earlier age.
Yes, sure. Thank you.
Thank you, ma'am, for the insights. There's another question coming up, which is, what's the cost of a genetic test?
The genetic test depends on what is the genetic test your doctor wants you to do. It's not like a one test, which is with standard test, which you can run through all the labs and check, which is minimum priced, but it depends on what is your history and what is the suspicion. So in your 20s, if there is a genetic test prescribed, it may be actually different from even your 30s, or if you have a family history with a certain pattern, it will be different. So normally nowadays, the trend is changing. We don't do single genetic test. We don't do single mutation testing. We normally do multi-gene panels. And multi-gene panel could be a abridged basic panel with 12 to 16 genes, or it could be 32 gene panel. Based on that, the cost varies. Or it could be even larger, 100 gene, 200 gene panel. And every technique what we use has a reason why it is being offered. So discuss with your doctor about that.
Sure, ma'am. Thank you. There's another question coming up, which is talking about that how effective, what should we do the self-screening for, as you have mentioned earlier also.
Why should we do self-screening? Self-screening is to diagnose any small mass or a lump which you may have missed, or any changes in the breast which you would have not seen in a mirror yourself. So examination actually rules out certain irregularities in the breast. And when you do it at a certain interval, once a month, then you can notice the changes. First time is probably just appreciating what is normal or not. And then next month, is there a change? Or next to next month, is there a change? And actually, breast self-examination has been ruled out as screening modality in the breast. But in India, breast self-examination is still very important, because most of them would not come for regular screening. We don't have a countrywide screening recommendation. So it's very important to do self-examination, especially in our settings.
Can you unmute, please, Navneet?
Still on mute, I didn't realize. So what are the chances of breast cancer post-menopause? Any correlation between both? I mean, the age and probably...
Most of the cancer are age-related. So yes, post-menopausal, the incidence of breast cancer is much, much higher. We collect mutations over several decades, and then it presents later in life. So most of the cancers happen later in life. Most of the cancers happen after 50, after 60, after 70. So the longer you live, the age remains the most important risk factor.
Totally, ma'am. Thank you so much. Another question is dairy milk linked to higher risk of breast cancer?
A lot of similar questions I listen to, but I don't know. There's no direct evidence, or there's no. I don't think there are any guidelines which says to avoid any dairy products.
Another question. Sorry. Again, I was mute. Sorry, I keep troubling. I think I'm like this. So is there a difference in the size of both the breasts? Is it a point of concern, or is it like maybe by birth probably?
Navneet, if it is a recent finding, you should visit a doctor. But if it has always been a little asymmetry is a norm for everything. But if it is a recent finding and it's a significant issue, then please visit and get yourself examined.
Sure, thank you. That's it, ma'am. Thank you so much for the valuable insights and the way you have answered the questions. I think all the clarity is there now, and we are very thankful to you. Over to you, Pallavi. Would you like to start something?
Yeah.
Thank you so much, ma'am, for your time, and definitely all the Mankidians. And we promise that all the females and as well as the male, whosoever have attended this session, they will definitely go and talk to their wives and their sisters, mothers, that monthly self-breast examination is very important. And that's how the awareness plays an important role. And we look forward for hearing from you for other cancers as well. So that for the male part as well, ma'am. So thank you so much once again for your valuable time. Dr. Iti, over to you.
Yes, I mean, thank you so much, ma'am, once again. There's so much of empowerment over the last 45 minutes for us in this screen, and also all the colleagues who joined from the organization. I'm sure this would make definitely a big difference. I'm sure a lot of more activities should come in future in terms of awareness, as you rightly mentioned. So once again, thanks for your time.
Thanks so much to each one of you.
Thank you, ma'am. Thanks a lot.
Bye-bye. Take care.